Hello, my name is Joseph Wager.
And my name is Allan Ridings.
We work for the Cooperative of American Physicians, the Risk Management and Patient Safety Department.
And today's risky tip is regarding security levels and passwords on your EHR system.
The scenario I want to talk about today has to do with an office practice that notices prescriptions are being completed by the front office. This physician, however, is on vacation for the past 3 weeks, so who's ordering the prescriptions? In retrospect, it was noticed that the MA had the password of the physician. Therefore, the MA is ordering prescriptions without the physician being present. As logic has it, passwords are intended for that provider only. The physicians are encouraged not to share passwords with each other and also not to share passwords with the staff. Each physician, each nurse practitioner, each physician assistant has their own passwords, and the same thing holds true for the front office and back office staff.
So what does this actually mean? It means that the lower level person, the medical assistant, is actually working outside their scope of practice. They are not allowed to write any prescriptions unless a physician has actually ordered it. They can call it into a pharmacy, but it must be done by the physician themselves. So why must you change your passwords every 60 to 90 days? Well, this is also a requirement of HIPAA, that your security integrity of your system is in place, as it also encourages your staff members to be in compliance with this as well. 60 days for your electronic system, or maybe 90 days for your hospital system. This includes every access that you have to every system in your office, be it an insurance company, a hospital, your system, or actually access to the computer system itself before you get into the electronic medical record system.
Traditionally, an office will complain about changing the passwords that frequently. We encourage doctors to change the password every 90 days for the mere fact that it ensures security. Our feeling is that basically if there's a breach of security somewhere down the line between someone in the office or someone else that's basically gotten to their system, the security levels will change when you change your passwords. Be sure that your passwords are changed every 60 to 90 days.
What this really means is the security level of this particular medical assistant that was writing prescriptions for the physician was not adequate and out of compliance. Please make sure that your offices are within compliance. Do not allocate a higher password to a lowest level employee.
As a rule of thumb, physicians must sign off their progress notes on their lab reports. Sometimes a physician feels that they need the assistance of the medical assistant. And as time goes on, they realize that the medical assistant is signing off on their progress notes and their lab results. It's imperative that every physician signs the progress notes and every physician signs off on their lab reports. The sharing of the passwords or letting your MA help you or assist you is against the law and should not be done.
What Joe is actually talking about here as well is that your extenders, that's your nurse practitioners and physician's assistants, are extenders of the medical practice. They are allowed to sign off. What we were talking about here is just the medical assistants and your receptionists. They are not authorized nor are they licensed to sign off on anything in the medical record except for their own intake and notes.
With the introduction of meaningful use in the future, patients will need a password to access their medical record. Traditionally, the password is provided to the patients via computer link, and the patients create their own medical record. It is imperative that the office informs that patient that that password should not be shared with other people, especially family members, and the password is there to access their medical record. Information is only for those patients only, and passwords are created by the patient for their own medical record.
This becomes extremely cumbersome in an office with pediatrics and also OBGYN, where both the mother and the child, a female child, is going into the office, because each person's medical record is unique and secure, and mother nor daughter should have access to either of the other's medical record. So therefore, what we're saying here is, on the patient portal, make sure that you access or have the patients access only their own medical record and nobody else's. So let's paraphrase here. Passwords, don't share them, don't give them to anybody else, including your patients. Keep them locked up and safe.
This risky tip and other episodes are available at our website, capphysicians.com.